Welcome to all of our members who have joined us for this week's Zoom session. These weekly videos are hosted by our clinicians on a number of topics related to your health. Each session will include a presentation on each topic, followed by a Q&A, during which you can ask questions along with other Cloud members. To see the upcoming webinar dates and presentation topics, take a look at the event page on our website. These sessions will also be recorded and viewable later by clicking on the live recordings archive page that's on the media section of our website. Today's topic is male hormone replacement therapy, what you need to know. And this is led by Dr. Tusek. During the presentation portion of this session, all attendees are welcome to submit questions for our host to answer during the second half of the webinar session. In order to do this, click on the Q&A icon in the menu at the bottom of your Zoom screen, and then click Ask a Question, which then you could submit either with your name or you can submit it anonymously. So then at the end of the presentation, I'll group all the questions that are similar together so that we can answer as many questions as we can. So with all that intro, I'm going to pass the mic over to Dr. Tusek to get us started today.
Thanks, Lauren. Hi, everybody. So today's topic is really male hormone replacement, which is focused on testosterone supplementation. And, this is something that we treat a lot at Cloud Medical. There's quite a significant incidence of what we call menopause. So we're all familiar with menopause in females, and us guys also will tend to drift down after a certain age, and some of the hormones that are related to vitality, energy, motivation, and general health, sexual health, overall vitality. So testosterone is one of the primary drivers of that. And so we look at it as both something to help in the here and now, if we're struggling with some of those symptoms, as well as something to use on an anti-aging basis.
Perfect. Thanks so much for that intro. I have a question to get us started today. Can you tell me what age that men should start testing their hormones?
Yeah, so, it's really helpful to have a baseline early in life. We actually recommend getting a baseline testosterone level in your 20s or 30s. We don't expect it to be low at that age, obviously, but the range is crazy wide. So the labs that we use, most of the reference labs that we use, whether it's LabCorp, Quest, or Access, or Boulder Community Hospital, the typical ranges are somewhere around 300 or 350 for the total testosterone on the low end, and 900 to 1250 depending on the lab on the high end. So there's variance between labs, and obviously the range is enormous. So the guy's going to feel different, very likely, at 301 than he is at 1199 for that total testosterone level. And that's not the only level that we're interested in. We also want the free or unbound testosterone, and that has a different range of normal. And so at age 20 or 30, again, we don't expect guys to be on the very, very low end or even abnormally low beneath or below that threshold, but it can happen. Nonetheless, we kind of want to know where our general operational level and range is. It's affected by a lot of things. So we want to make sure we get plenty of sleep the night before. We actually don't want to have sex the night before a testosterone check. We want to obviously be fasting, as we do for pretty much most of our blood tests. And we want to recognize that there are various ways, depending on what that original baseline test comes out at, to modulate that, to modify that, not just with actual exogenous testosterone hormone replacement, but certain lifestyle maneuvers. certain changes in our lifestyle or natural ways of supporting our testosterone. So that's probably something that we'll get into.
Perfect. So you explain the range, low versus high. And the concern is when we're low, when someone has low testosterone. Can you tell
Mhm.
me what low testosterone usually feels like? And then
Mhm.
also, what are some of the causes of that low testosterone?
Yeah. So, there's a lot of overlap with many, many conditions, of course, as always. But the classical symptoms are I just feel more pooped out than I feel like I deserve, given my overall lifestyle. I just don't have the energy or the vitality or the life force. That oftentimes spills over into things like motivation and a sense of get to itness. I want to pick a goal, accomplish a goal, and move on to the next goal. And sometimes when our testosterone levels are sluggish, we just don't have that pep. It also spills over into our uh, exercise, and our capacity to move our bodies is limited in the sense that oftentimes the recovery time is much longer. So I'm used to doing a really hard workout in the gym or going on a long hike in the mountains. And I know that I, bounce back pretty quickly and feel good the next day. When our testosterone levels are low, it
Mhm.
takes days sometimes to recover from muscle soreness and post-exercise or post-exertional fatigue. And then, of course, it spells over into our sexual health as well. Our libido isn't as high, erectile function isn't as good, and that overall sense of sex drive is definitely limited. So that's how it feels in general. There's also mood effects. So the mood effects of low testosterone tend to be a loss of agency. It's a loss of kind of, I know where I'm going, I know what I need to do. And um, people just don't feel that they're in command, or they don't feel empowered in their lives. By the way, testosterone is important in women as well, and many of those symptoms are present for women whose testosterone levels have dropped
Mhm.
below a certain threshold. So those are the most common symptoms. In terms of what are the drivers of that, I mean, here's what we know. When I started practicing medicine, even the reference ranges, like this was, not 100 years ago, this is like 20 years ago. The reference ranges of normal testosterone levels were much higher than they are now in terms of what the labs or the lab values that were considered normal were set to be. And, this is sort of followed or paralleled a pattern of general and gradual reduction of the average male testosterone range or testosterone level. There have been many articles and topics of video chats and podcasts and
Mhm.
blogs and things written and proposed as explanations for why that might be.
Mhm.
Um, it's pretty clear that there are certain exposures environmentally that many of us uh, find it very, very difficult to eliminate. Exposure to chemicals in water, exposure to chemicals in the vessels of our water and food and beverages, i.e., plastic bottles, um, chemicals that are sprayed on top of our food or on top of the soil where the food grows and things of that sort that clearly play a role. Many of them chemicals that we're familiar with by name, BPA, it's kind of notorious. Why is it bad for you to have too much BPA? Well, it's an endocrine disruptor, meaning it messes up our hormones. And one of those hormones that's vulnerable to that is testosterone. So we don't know exactly what cocktail or combination of environmental chemicals is sort of leading to this, I would say, fairly massive decline of testosterone, as well as, the downstream consequence of that, which is male fertility. Those rates are also plummeting. So we can point to those things. We can't necessarily be precise about them. I will also point out that it's not just the testosterone level that's the only important variable in this whole endocrine male hormone matrix. It's the concept of aromatization. And aromatization is the conversion of testosterone to estrogen.
Mhm.
So in male and female bodies, estrogen is made from testosterone. So testosterone is a precursor of estrogen. So even women in their ovaries, in order to produce and synthesize estrogen, which is the male or the main female hormone, requires the synthesis of testosterone as the prohormone or the upstream molecule that is then converted by an enzyme called aromatase into estrogen. Obviously, that enzyme is more active in women than in men in general. And nonetheless, some guys are what we would call hyper-aromatizers, meaning more than average or more than normal, they will convert their testosterone to estrogen. So we want to be mindful of both of those hormone levels. And in fact, sometimes it's not a matter of telling a guy who has low testosterone, gee, we need to add more testosterone to top your levels off. Rather, when we see that their estrogen is really high, it's limiting or blocking the over conversion of testosterone to estrogen. It's almost like creating a little dam so that level can rise back up to normal, as opposed to introducing more of a hormone that's not actually necessary.
So fascinating, the whole thing. Thank you. With the concern being low testosterone and wanting to boost that, is there a way that men can try to help boost their testosterone levels naturally?
Yeah. So we've prepared a whole handout, and if anybody's interested in receiving that, just email us at info@cloudmedical.io. We'll be happy to send it to you. It goes through a series of lifestyle factors that are really, really relevant to endogenous testosterone production, to supporting our own innate capacity to produce this hormone. Um, you know, lift heavy things is a good sort of rule to hold on to. And we want to be, of course, very, very careful about that. So while I completely agree that of all sort of 5 forms of exercise, which we can just quickly name, there's cardiovascular exercise, there's resistance training, there's deep stretching, there's stability training or proprioception training, and then there's rest. We always want to give our body a break. Among those, if you had to pick one, I think most people would agree that resistance training really is, in terms of vitality, lifespan, health span, anti-aging, all of those goals that we have for our bodies. Really, resistance training is probably the most important. I think they're all important, but again, and I would not favor picking just one, but if you had to, it probably would be that. That being said, you don't want to start lifting heavy things when you're not used to doing so. So proper technique is absolutely critical. And getting a trainer who can guide you through that precise technique is absolutely essential. That being said, working your way up to being able to, move a good amount of weight with a bench press lift, with a squat, with a deadlift, etc., really is something that stokes our endogenous testosterone production as well as growth hormone production, probably more than anything. Sleep is absolutely critical. Avoidance of toxins is really important. Cannabis, in all of its various forms, seems to be a powerful suppressor of testosterone production. So all of the 5 pillars of health are important: hydration, nutrition, exercise, sleep, and stress reduction. I would say the lifting heavy things is probably the most important, but I'll also point out that we've had, just even in our practice, never mind in the literature, people that were, let's say, men in their 40s who came back with a relatively low testosterone level in the 3 to low 400 range, who, in addition to lifting and going to the gym and exercising, went on a low carb diet. And those 2 interventions together seem to be very powerful inducers of, again, that hormone production capacity. So there's something about eating high carbs that limits or puts a ceiling on our capacity to produce this hormone. And then there's a whole stack of supplements. Zinc is one of the main ones, but there are a number of herbals that we go through in that handout, and we'll be happy to share that, as I mentioned.
Thank you. If natural replacement isn't doing it, what then would be the next step? So leading into this question of what are the main kinds of testosterone replacement therapies?
Yeah. So if we've done our due diligence and we've said, all right, we've ruled out all of the obvious things that could interfere with our testosterone production. One that I didn't mention, it's not that common, but we always have to think about it, is that there are certain men and women who produce excessive levels of another hormone called prolactin, which is very, very likely to cause an interruption of testosterone production. So, during that workup at some point in time, it's good practice to just make sure we've checked that box and we've ruled out a prolactin situation, which usually comes from an actual adenoma or prolactin secreting tumor in the brain, in the pituitary gland. And that can be, if the prolactin level is high, generally we want to do a brain scan or a brain MRI of the pituitary gland. So we've ruled those things out, or at least we've thought through them. We've established that it's not an over aromatizing process, and they don't just need a little enzyme blocker. We've looked at their lifestyle and said, okay, you seem to be doing things properly, and you've implemented some of the natural testosterone boosting protocols into your life. And we're still not getting anywhere. Then certainly one becomes a candidate for TRT, for testosterone replacement therapy, of which there are numerous methodologies or modalities that we can implement, but the main ones are either using testosterone as an active hormone in the form of an injection, in the form of a testosterone pellet implant, or in the form of a topical bioidentical testosterone cream. All 3 of those are using live actual testosterone hormones in various forms, typically testosterone cypionate, sometimes enanthate. There's a few others. Or we use a pill that actually induces and the signal from the pituitary to the testes to endogenously increase the output of testosterone. So, and that pill is called Clomid. So we can hit it from different angles. I would say most commonly we use one of the testosterone replacement modalities, whether it's cream, injection, or implant, and that's totally up to the patient. A cream is nice because it doesn't require any needles or any implant procedures, but it's a pain because it's a topical daily application. The shot is nice because you only have to do it every 1 to 2 weeks typically, although there are protocols that are more frequent, but generally speaking, most guys use it either on a weekly or twice a month injection program. But some people hate needles. And the pellets are great because they only require 2 visits a year. We really find that they last by and large about 6 months. So you'd only have to come in twice a year for the implant procedure. But there again, some people don't want a procedure at all. So it's really deciding which of those is more pleasant sounding to you. The one thing that I'll say is with the creams, there is a consideration if you have small kiddos in the house. You probably want to be extra careful to ensure that there's no potential of any kind of trans contamination, because the creams are quite potent and they certainly can be transmitted through, if you apply them to certain body parts and then you hug your child, that would not be a good idea. And that is something that we sort of talk through. But in general, it's really up to the patient and we can work with any of those. The Clomid is nice because it's just a pill. It's a daily medication. Sometimes you don't even need to take it every day. Usually it's a daily pill. The downside of that is it will not take you up to the level of what most people's goals are, which is if you're going to do it, we want to do it like we mean it. We want to get to a level of, let's say, the upper limit of, still within the normal range, but within the upper limit of the normal range, around 1,000, 1,100, 1,200. You'll not reach that range with Clomid. You're going to probably top out at 700 or 800. So that's just a quick overview of the different options.
Great. With all those options considered, can you tell me what are the risks and also the benefits of TRT?
Yeah. So the benefits, very briefly, are the ones that we mentioned: an improvement in all of the symptoms that we talked about, more energy, more vitality, better exercise recovery, better mood, oftentimes, particularly if estrogen and testosterone are really carefully balanced, and more libido. In terms of risk, the big boogeyman or the big concern for many decades has been, are we potentially fueling the fire of an early prostate tumor and increasing the risk of prostate cancer? That has pretty categorically been disproven. And, we can point to many meta-analyses in the literature, review articles that really looked at all of the data, and the conclusion has been, no, it doesn't seem to be the case. Nonetheless, we definitely advocate for prostate cancer screening while you're on TRT, but we do that whether you're on TRT or not. So that's not really a material risk. Again, if you have active prostate cancer, we definitely don't advise that you maintain your testosterone regimen unless your urologist determines otherwise. In terms of other risk, one we already talked about a little bit, the potential conversion of testosterone to estrogen. So if you're already aromatizing significantly and converting T to E, and you add more testosterone, you can end up with even more estrogen. And certainly the side effects of that are generally unfavorable. Gynecomastia is one, where a man will develop breast tissue. Too much testosterone itself will cause acne in both men and women. So we definitely want to limit that. That usually happens if you overdo the range. So if you're staying within that, below 12, 1300 range, it's very unlikely to get acne. But it can happen, and we certainly track that. And then, the other hormone that testosterone as a parent molecule can convert into is called DHT, or dihydrotestosterone, which has some benefits, but some people call it the evil twin of testosterone because it's the one that drives prostatic growth, benign prostatic growth, not cancerous, but that can interfere with urination and urinary stream, or hair loss. So ensuring that we're not overdoing DHT levels in the context of testosterone therapy is also an important consideration. Those are sort of the main ones. There are rarer side effects. Again, generally these occur when the estrogen testosterone balance isn't optimized, like leg swelling and things like that. But those are the main ones.
Great, thank you. I just want to make a point that we haven't received any questions yet from our attendees. If anybody wants to send in anything, we still have a couple of minutes. We'd be happy to answer your questions. So I'll wrap us up with that in a minute, and I'm going to ask my one last question from me, and then we'll go from there. So Dr. Tusek, if I suspect that I have low testosterone, what are other things that I should consider so that I can know whether or not it is testosterone that is driving my symptoms?
Yeah. So it's definitely the case that the numbers don't always correlate with symptoms. So a guy can have a relatively low-ish number, let's say 400 or 500, in the kind of lower end of normal, and have absolutely no hypotestosterone or low T symptoms whatsoever, and you feel perfectly great. Conversely, a guy who has a level of 900 or 1,000 may have many or all of those symptoms of low T. So sometimes it's a little tricky to
Mm,
sort out, and there are a number of potential reasons for that. One of which is called testosterone resistance, where it's not the level of the testosterone, it's actually on a receptor basis, where the receptor is not as sensitive to that molecule. Um, but in general, one of the ways to suss this out is, are my symptoms due to low T, yes or no? I
mm,
find to be very effective is what we call a test of cure. So we say, look, we're not committing to anything long term. We're not saying that this is your new regimen. We're just saying, let's try it out. Let's try it for a month. And we usually do a protocol where we do a series of 3 injections over the course of 30 days. So day 1, about day 14, and then about day 30. So once every 2 weeks for a total of 3 injections, during which, if you're starting out low, I guarantee you will get to that 1,000 or 1,200 mark, at least during a number of those days in that 30-day period. And you'll kind of just feel into what that's like. It's kind of like taking the car out for a spin. Before I buy the car, let me test drive it. And so in this way, we have men, again, who we didn't expect to be really responsive to the testosterone replacement therapy, who find that it's absolutely dramatic in terms of the impact of how much better they feel. And then there are other times when we expect it to really work and it doesn't do much. So I think establishing whether or not this is actually a really big lever for your optimal wellness and well-being before we commit to anything super long-term is a great idea. And the test of cure accomplishes that generally quite well.
perfect. We haven't received any questions, so I'm going to wrap us up here. I would love to know, what are my next steps? Somebody has listened to this talk and they say, I resonate with so much of what you just said. I need to know what to do here. What would one of our patients do next?
Yeah. Well, all of our practitioners are very familiar with both male and female hormone replacement. We have standard labs that we run.
Mhm.
We can do this as part of your annual checkup. Certainly if you're in any of the middle-aged years, I think it should be included in your annual checkup. And then certainly if you have any of those symptoms and are interested in, and you haven't had those tests, yeah, please reach out to us and we'll be happy to arrange those. And then we can interpret the results in the context of all of these different themes and topics that we covered, and hopefully that was helpful.
Perfect. So next step is give us a call here at the office and we will schedule you for an appointment and discuss what your next steps are, everything that Dr. Dusek just shared. Thank you, everybody, for joining us. This was another really fantastic session, so incredibly informative. Just really great that we have these sessions going now. Thank you for your time and your preparation, Dr. Tusek, and sharing your wealth of knowledge with us. We look forward to seeing all the rest of you here at another session in the future. Come with your questions. Let us know if there are any topics that you want to know about, and we would be happy to develop a session based on that with one of our providers. Wishing everybody a lovely evening and keep an eye out for future events and other recordings as well. Thanks again.